Vitamin D, most heralded for bone health and immunity, has also been shown some promise for reducing depressive symptoms in people with depressive disorder, even up to major depressive disorder. But, there's a big but, we didn't know exactly how much vitamin D was the optimal dose to date for improving depressive symptoms. After this recent meta-analysis, we now do. At least we have a good idea. And this is pretty big, right? Because we know that less than 20 nanograms per deciliter indicates a deficiency in vitamin D. Typically, people who are deficient in vitamin D see a lot more benefit when they supplement with it. Like any other sort of vitamin or mineral, it really works when you're deficient. When you don't have enough of it, then you get enough of it, and it does its job in the body. In simple, and you'd like to get it from food. In this case, you'd like to get your vitamin D from sunlight. Of course, animal-based foods also have vitamin D3. Salmon has the most, I believe. Now, typically in these trials, we see a small to moderate effect size in improvements in depressive symptoms. So they're not massive improvements. It's relatively inconsistent. For that reason, vitamin D lands at a secondary option for improving symptoms of depression. Primary options would be saffron, omega-3s, and our secondary options, if you guys just want the gist here, would be vitamin D, would be St. John's wort, and light therapy. All right? But another interesting thing before we get into this trial on how much vitamin D3 is the optimal dosage, spoiler alert, it's about 5,000 IU, could be 4,000 IU, we'll talk about why, is it typically works in trials that have a shorter duration. Typically trials that are less than 24 months, for example. So why is that? You know, maybe we're building up levels of vitamin D over time. It is a fat-soluble vitamin. Maybe we're storing some of it. Who knows? But for the most part, it seems that it has a small to moderate effect size, works best in people that are already deficient and or people that are depressed. And this trial showed us how much. It was a we'll finally get to it. Meta-analysis of 31 randomized control trials involving thousands of people that provided anywhere from 1,000 IU up to 8,000 IU of vitamin D3 per day. And they assessed improvements in their depressive symptoms lasting over 2 years, did many of the trials. Most of them were 24 months or less. And they found that the optimal dosage for reducing depressive symptoms was 5,000 IU. Now, it didn't reduce them to the greatest degree. That was 8,000 IU, but you do run the risk of certain health complications, such as an increased risk for falls in the elderly with higher doses than the tolerable upper intake level of vitamin D3 per day. As great of a supplement as it is, as great of a vitamin, really a steroid hormone as it is, you don't want too much of anything, right? Copious amounts of anything isn't good. And so we would like to obviously have anywhere from 4,000 to 5,000 probably at the most for the average person. You talk to your doctor about it. It depends on your condition. It depends if you have dark skin, if you're elderly, right? Those demographics typically need a little more vitamin D. But, you know, we would like to probably fall in that range, and it works well for a shorter period of time. Sometimes people will get a bolus dose, so they'll get one large dose every 4 weeks or something of that nature, 50,000 IU. And, you know, there's research that says that's good too, and this and that. Totally depends on your condition. But in this trial, they showed those lasting less than 24 months, right? So less than 2 years, there was the greatest benefit of vitamin D3 supplementation. After 5,000 IU, so we had improvements from 1,000 IU to 5,000 IU. There was actually 3 times the improvement in depressive symptoms. So 5,000 IU was a lot more effective than 1,000. But when we got past 5,000, there were diminishing returns. So it didn't really seem worth it to have any more than that. You would, of course, like to take it with vitamin K2 to regulate the absorption of calcium, right? Because vitamin D3 supports calcium release, it supports calcium absorption. Now you want to make sure that calcium is absorbed into your bones. You want to make sure that it doesn't get absorbed into small tissues like arteries, right? And calcify arteries, because that wouldn't be a good thing. So that's the long and short of vitamin D3 and how it could potentially improve depressive symptoms regarding its dosage and what we have to date. So pretty new research, my fine feathered friends, and I hope you found it interesting. That's what we got for you guys. we're going to sing a song to somebody. It's a song that we sing almost every day. It's a happy birthday song. And it's to Lou Ferrigno. Happy birthday, dude. This one's for you. Coming to you in the car on the lunch break, covering another chiropractic office in Amityville, New York. Happy birthday to you. Happy birthday to you. Happy birthday, dear Louis de Berdines. Happy birthday to you. So many more, big fella. I love you, man. I got to see you soon. I hope the family's doing great. Who do we got out here? Say what's up to everybody. Long Island Pete, what's up, Pete? Hey, yo, Housen, how you doing? Megan, what's up, baby girl? Brandon Malone, CR3. And Sawyer. As for now, so we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great rest of your day. Thank you very much, and happy Wind Wellness. See ya. Hey, Ash.